Welcome to Tea Time with Doc. I'm I'm your host, Dr. Dipali Kashyap from Galleria Women's Health. We are located in Green Valley District in Henderson, Nevada. We provide quality women's health care. Tea Time is a segment dedicated to women and guiding women through health and wellness. So let's begin. So today I thought let's talk about emergency contraception. As the name indicates, emergency contraception or birth control is using birth control when somebody had unprotected sex, either if they're not taking any birth control, or let's say if they're on pills and they have been skipping some pills, or if they're using condom and there's a condom slippage or breaking up of the condom, or even in sad situations like rape when somebody's not anticipating and is not on any birth control. So there are two types of emergency birth control that exist these days. One is intrauterine device and the second is the pills. Intrauterine device is a copper IUD, which is actually used normally and it's good for 10 years. But even as an emergency contraception, it is effective if it is used within 72 hours or 5 days of having unprotected intercourse. Anytime we're using emergency contraception, it's best to use it as soon as possible. But let's say if there is a delay, then up to 5 days or 72 hours to be more specific, the IUD can still be used. It is done in a medical office setting, so you do need to have either an OBGYN or your primary care doctor who places IUDs. And remember, anytime when we talk about emergency birth control, remember that these are not causing abortions. In fact, they will not work if there is already a pregnancy in place. They just help to prevent a pregnancy to happen, but they do not harm the existing pregnancy. The second option is the pills. So in United States, there are two forms of pills which are FDA approved to be used as emergency contraception. One of them is called Oliprestol, or the brand name is Ella. This is a prescription-only medication, and it works by blocking the effects of progesterone, which is an important hormone for development of the pregnancy. So this again, better to be used as soon as possible, but can be effective until 3 days. I mean, some places they even say it is effective until 5 days, but I would generally say until 3 days it is effective and better to be used as soon as possible. The other commonly used and which is also available over the counter is the progesterone only pills. They are really high dose progesterone pill, which is also called morning after pill or plan B pills. They are available. Now, initially you said, okay, progesterone, the first pill which we're saying is actually blocks the effect of progesterone. But in this one, we're using really high dose of progesterone, which prevents ovulation. And that's how it prevents pregnancy to happen. Even regular birth control pills in a higher dosage can be used for emergency contraception, but then I wouldn't rely on that because different birth control pills that exist in the market have different amounts. So it really needs to be calculated as to how many pills one would need for them to work as emergency contraception. Can this be used more than once? Yes. In one menstrual cycle, you can use the emergency contraception more than once. But remember, we don't want to rely on them as method of birth control. Use them only when really needed. What are the side effects? So the most common side effects are feelings of nausea, even throwing up because these are higher dose hormones, then breast tenderness, some abnormal bleeding, then the next period will be probably off. You won't get it at the regular time. So these are the most common side effects. What else? So let's say if somebody is already on birth control and they did use the emergency birth control, then if you use progesterone only, you could still you can resume your regular pills, but use condoms or other barrier methods for at least 7 days. And let's say if you're not on any form of birth control, then it's a good idea, maybe use this as an opportunity to see your gynecologist or your primary care doctor and get started on a birth control. So these are the main things about emergency contraception. If you have any questions, don't hesitate to reach out to us, and I would be happy to answer any questions you have.
Right, so that was another segment on Tea Time with Doc. Thank you for tuning in, and I really hope you found it useful. Well, if you have any questions, any comment, or any other particular topic that you would like me to cover, I would be very happy to. Just let us know. And do visit our website, www.galleriawomenshealth.com. We do have tons of information over there. Thank you, and have a really good and blessed day. Till next time, bye.